everyone, my name is Melissa Diaz. I am a pre-medical student at FIU pursuing a double major in psychology and natural and applied sciences, and I will be providing you with the personal motivators behind my career in medicine and how it all ties into the class we're currently taking, Physics 1 with Calculus. My choice in pursuing a career in medicine was deeply personal. It all began when my grandfather was diagnosed with Alzheimer's disease. I saw the significant impact that disorder had on my family, on my mom who was taking care of me, and the emotional impact it had afterwards when he passed away, sadly, because of that disorder. So after I saw that, I became automatically driven to pursue medicine, and specifically something around the lines of neurology, where I could help patients and families struggling with the same neurological disorders that are such a burden on their lives. I could provide treatment and medication and comfort to them as a doctor, and that enticed me more than any other career that I could have. And choosing a major in psychology was certainly very deliberate because it allowed me to investigate and explore the intricacies of the brain in a deeper manner, as I never would have in the past. So that's that regarding my career and why it all began. So knowing that I wanted to pursue medicine, I became very involved in building my repertoire of knowledge and my skill sets to be a good physician onto my patients in the future. Among said skill sets include empathy, work ethic, and attention to detail. And I believe there are three main activities that I'm currently engaging in that allowed me to expand upon those skills. Among said activities include my work as a medical scribe, which has allowed me to develop a lot of work ethic. There are multiple patients that come with neurological disorders, as well as upper respiratory disorders and all of the sort. They come with vertigo, dizziness, dementia, similar to what my grandfather had, and that allowed me to understand that in those conditions you have to work really high-paced because there are multiple patients that come in one day and you somehow have to do it all. And I saw how the physician did it and became very, very inspired. Among the other activities included my job, or rather my volunteering position in Catholic Hospice, which allowed me to talk to patients that had these disorders and build my empathy. I also saw families that had to deal with the death of loved ones because of Alzheimer's and because of other pulmonary conditions as well, and I became even more driven to help them in the future. The other particular skill set that I developed was also attention to detail, and I believe my job as a lab assistant in HWCOM, which is a volunteering position rather, has allowed me to really hone down those skills because you have to have a really low margin of error as you're working with cells. This lab specifically deals with Alzheimer's disease and risk genes associated with it, as well as exploring potential treatment options. So it has also allowed me to expand my knowledge on Alzheimer's disease, which is definitely an interest of mine. So that's regarding those skill sets. One of the main skills that I mentioned was work ethic, and I do believe that this course has allowed me to cultivate more of it as the time has progressed in the course. Initially, some of the problems on force, momentum, springs may seem daunting, but if you actually look into it and if you practice continuously and develop good work ethic, you can figure it out. And I believe that applies to this class and any class, in that it can teach you the fact that if you continuously work hard and put in the effort, you can come to a viable solution. And that I really appreciate because it is one of the skills that we need as a physician, and that this class has allowed me to expand upon. This class has also allowed me to expand upon critical thinking. You may see a problem and it has the same concept as the other, but the methodology as to how to solve it may be slightly different. You need to learn to be very adaptable. And the same applies to the clinical setting, where you're dealing with patients that may have a condition or diagnosis similar to the one previously, but there are some alterations in the treatment. And you need to learn how to, see that and be able to adapt your treatment to that specific patient. And I believe that this course definitely allowed me to understand that, allowed me to also understand how to break up fundamental concepts into smaller ones and to, based on that, derive a viable solution. Also, the mathematical proficiency required to do well on this course is also very much needed if you want to engage in medical research in the future. So this course has definitely allowed me to practice that and to expand upon that as well, which is definitely a very valuable skill set. So thank you for listening to my video. This is the reasons why I wanted to pursue medicine, the repertoire that I built to be able to, get ready for that moment where I can become a physician and help patients, and how it all ties into our class currently, Physics 1 with Calculus.